Welcome to Damie Health on YouTube. Dr. David Duizer here, and in today's vlog, we're sharing episode 1 of Holistic Approaches to Weight Loss, our weekly Facebook Live that we do on Mondays at facebook.com/DamieHealth. Enjoy. Welcome to the Damie Health Facebook page. My name is Dr. David Duizer. I'm the medical director here at Damie, and you're watching Holistic Weight Loss Principles, our weekly show about holistic weight loss. This show is all about how to lose weight without counting calories using holistic weight loss principles and the approach of the Damie Lean program. We'll cover multiple things that are present in the Damie Lean program at a surface level and show you how the holistic approach is so incredibly effective for weight loss. To start today, I'd like to talk about the traditional approach to weight loss. Traditionally, weight loss has been all about cutting calories. It's all about eating as lean as possible and eating as clean as possible. And that's all great, and it can be helpful for some, but for many it's not the answer. The other approach is a total restrictive diet where you completely eliminate one food group from your diet and just try and go on forever without eating that one food group, hoping that your calorie reduction will be significant enough so that you can actually lose weight. We know that that approach is not sustainable either, and that's one of the reasons why we have been so heavily invested in the holistic approach. Aside from our backgrounds here at Damie Health, we really believe that a balanced approach to weight loss is the most sustainable and the most effective long term. So we love the holistic approach, and that's why we've decided to start this show as a complementary program to the holistic approaches that are included in the Damie Lean program. So the holistic approach is completely different from the traditional approach, which is just cutting calories, and the restrictive approach, which is just cutting one food group out. So we love this approach, and throughout the course of this program, we will show you why. You're on this page because you care about your health. You're here because you're interested in a balanced approach to health, and with that, usually weight loss occurs if you have some weight to lose. So this show is all about teaching the healthy, balanced approach to boosting your metabolism through nutrition, through diet, through exercise, and through supplementation and other ways of balancing your organ systems and bringing balance back to your life in general. So welcome to the show, welcome to the page, welcome to the program. We're so grateful to have you, and let's jump right into it. So yes, the goal of this series is to teach the holistic principles, but please know this is not medical advice. If you want to work on your weight loss specifically, join the Damie Lean, and if you want to bring up these principles with your practitioner or with your coach or with whoever you're working with, do so, but don't take this as medical advice on its own. First, a little bit about me. I'm a naturopathic doctor in private practice here in Vancouver, British Columbia, and I've been the medical director of Damie Health for a few years now. I'm the co-founder along with Amy Lane, but I've stepped into the medical director role and have an active role in the Damie Lean program. I do the weekly Facebook Lives on Tuesdays for our members, where we just do Q&A and chat for a little while about their week and try to make improvements moving forward. So that's kind of my role at Damie. In my clinical practice, I practice mostly integrative chronic care. So I do a holistic approach to chronic disease management, and with that I do a ton of holistic weight loss work in my practice. Obesity has been correlated with pretty much every disease and now 12 different types of cancer. So when we're doing integrative chronic care, we're heavily focused on bringing weight down and practicing that and bringing it down in a holistic manner. So it's a heavy part of my practice, that's for sure. Our goal at Damie has been to combine the general principles that have been so successful for Amy's previous programs with some of the holistic principles that I have learned, and to develop a program that encompasses everything. Amy has been teaching her principles since 2009 and has had success with 5,000 members of her Damie programs. And now we're so grateful to be able to come together and bring what she has always wanted to bring to the program, which is a holistic approach. She has her holistic nutrition background, and now I'm bringing the medical side to Damie. So grateful to be here, and so glad you're part of our page and watching the show today. Today's program is the holistic approach to thyroid management in metabolism boosting. So the metabolic boost to the body through stimulating thyroid function. Now, this is important in holistic weight loss because if the thyroid is out of balance, it's you can really gain your quickest results by bringing it back to balance. So I'll say that again. If your thyroid is out of balance, the best success you're going to have is simply bringing the thyroid back to balance. All of the core weight loss principles that we teach on our Damie programs, their results are amplified if the thyroid is out of balance and then brought into balance. So I really wanted to cover that today in the first show because it's the thing that can give the most benefit if it's actually out. So that's what we'll cover today. Now, some things to talk about with regard to the thyroid, kind of the three secrets or the three keys of today's show. Number one is the thyroid sneaky. You don't have to have all thyroid imbalance symptoms to have a thyroid that's actually out of balance. I'll go through the symptoms quickly. The symptoms of having a sluggish thyroid would be constipation, cold hands and feet, difficulty losing weight, low energy, and hair loss or eyebrow loss. You don't have to have, and a puffy neck, noticing a swollen thyroid. You don't have to have all of these symptoms to actually have a sluggish, you don't have to have all of these symptoms to be suffering from a slow thyroid. Even if you have one or two, or one is slightly there, your thyroid could still be out of balance. So bringing it back to balance can be, the best possible thing in holistic weight loss. So I'll cover the symptoms again: constipation, difficulty losing weight, low energy, cold hands and feet, dry skin, hair loss or eyebrow loss. Those are the common symptoms of a sluggish thyroid. But like I said, you don't have to have all of them to warrant a test. Now, number two, in terms of keys to managing your thyroid, testing is really easy. You can start with the basic TSH test, which is just the thyroid stimulating hormone, which is the signal from the brain that tells the thyroid, oh, wait a minute, you need to be reducing or releasing hormone. It's time to go. We need to boost this metabolism. And then what happens, those hormones are released and they send a feedback to the brain to calm down. So basically, when the brain signal goes up, it's that the thyroid hasn't released enough hormone because that feedback is blocked. So basically, when the thyroid is sluggish, the main test, the TSH, is actually high. It's kind of counterintuitive. When you're sluggish, you think low, but sluggish means that the TSH is actually high in most cases. So we start with just a basic thyroid test. You can get it for free from your family doctor, and through private medicine in British Columbia, it's $20. It's an easy test to do. That being said, when you're testing a thyroid, we like to see the actual hormones involved as well. We like to see T4, which is the first hormone, and T3, which is the active thyroid hormone. This conversion from T4 to T3 is very important. But if you're unwell, if you're stressed, or have come down with a cold, or you're inflamed for other reasons, then you might not want to have your T3 tested because it could be out of range, just because of what you're going through. So T4 is important, but if you're feeling okay, if you're feeling normal, T3 is very important as well. So start with the TSH, and then if you really want to go deep, get the T4 and the T3 in addition to complete this portion of the panel. That's the easy check. If you go to your medical practitioner and you say, listen, I'm having difficulty losing weight, I'm also tired, can we check my thyroid? You usually can get a thyroid check pretty easy, and you can know really in 24 hours if your thyroid is out of balance. And then the third key is that there's different methods to boosting. You don't have to take medications if your thyroid is in a certain range. If it's completely out of range, then yes, medications are important, but you don't actually have to go with pharmaceutical. Even in that case, you can go with bioidentical. So the third key is that there are multiple ways to boost the thyroid, even if it's completely out of range. I'll start with these three keys by going back to each one and covering them individually. Number one, the thyroid is sneaky. So you might not have all of the symptoms. But you could still get checked, and you could still find benefit in the assessment. So you might be thinking to yourself, oh, I don't have any of the symptoms, or I'm not even in the range for one of the symptoms. Well, I've got stories of cases where patients haven't had any, but they've had difficulty losing weight as their only symptom, and we've run TSH tests and it's been out of range. I've had a series of patients who have been eating restrictive diets, low-calorie diets for many years, exercising consistently, and just been so incredibly frustrated with their inability to lose weight. We've run a TSH test, and if the range is decimal 3.6 or decimal 3.9 to 5, we've seen some scores of 44, 45. We've seen completely out of range, which is just clinical hyperthyroidism, even with the only symptom being difficulty losing weight. Now, why would this happen? This could happen because so many people are just healthy overall. If they have constipation, they take some psyllium, then they have a nice bowel movement. If they have low energy, they take some rhodiola or some ginseng, and it helps them. If they have low energy, they just chalk it up to being overworked or an insomniac. They don't ever think to have an assessment done. So I'm here to tell you that an assessment is worth it if you have any of the symptoms on the spectrum. That's the first one. The second one is checks are easy, 2 levels. The checks are so simple. The TSH test, even if your numbers are in the range. We've had some, you might be thinking, oh geez, I've had my TSH test and it was in the range. My TSH checked and it was in the range. Well, good, but if it's above 2, your thyroid might not be optimal. We know that people lose weight, their metabolism is boosted to a point where weight loss is easy when the TSH is below 2. Still above the lowest limit, but at least below that 2.0 level. And when that happens, weight loss is just so much easier than when that TSH is between 2 and 5. And of course, versus when it's above 5. If it's above 5, you most likely will need medication. But if it's below 5, but above 2, you could get a significant metabolic boost by suppressing it to below 2. So I want to make sure I noted that. If your story is, well, my TSH was in a normal range, my thyroid's fine. Wait a minute, what is the number? So please check that. Number 3, forget the weight loss pills. If you're between 2 and 3, or 2 and 5, you can get away with just supplementation to boost your metabolism, but you do not need stimulants. You do not need classic weight loss supplementation. You do not need caffeine pills. You do not need significant adrenal boosters. You may just need some nutrients to support thyroid conversion. You may just need some nutrients to support thyroid production. Now, what are those nutrients? To make thyroid, you need tyrosine and iodine. So if your level is between 2 and 5 and you want to support thyroid production, tyrosine and iodine is a good place to start. If your TSH is between 2 and 5 and your T4 is normal, you might want to boost your T3 by supporting the production of T3 through the cofactors involved in the conversion of T4 to T3, which is selenium and zinc are normally what we use, but I like to use a multi that has vitamin A, C, E, and then zinc and selenium in addition to. So those are kind of the different protocols. If your TSH is above 5, then you want to consider medications. Synthroid is fine on its own, but you may actually need those nutrients to support the production of T3 from synthroid, because synthroid is actually synthetic T4. So those nutrients again would be zinc and selenium. If your TSH is, or if you do not want to do pharmaceutical, if you do not want to do synthroid, then you can do bioidentical thyroid hormone, which would be called desiccated. Now, for any of these prescriptions, you'll need medical advice. You'll need to see either a naturopath or your family doc to get a prescription, but you'll see results right away. If your TSH is above 5 and you take either synthroid or desiccated within a couple weeks, your metabolism will be significantly boosted and you'll be on track for weight loss like you haven't been in such a long time. So it's really worth getting checked out and started on a program if you're in one of those situations. Finally, I want to finish by restating the purpose of today's talk. Weight loss isn't all about cutting calories. Cutting calories is not always the answer to weight loss. The holistic approach is so much healthier, so much more in tune with a healthy lifestyle long term, so much more sustainable for everyone. restricting your diet and cutting calories in general is very difficult if you're used to eating a certain way and if your lifestyle is on a certain pattern. Finding a holistic approach, finding a balance through natural medicine and through holistic nutrition and a program like the Damie Lean is really the way to go, because it's so incredibly healthy and so easy to sustain long term. So I love this approach, and balancing your thyroid is just one part of it. It's really important as an initial step because it's the quickest way to get results if you're actually out of balance. So on a final note, I want to mention today before I close about what the Damie Lean is all about. The Damie Lean is this holistic approach to weight loss, but it includes two separate guides. First, it's the basic holistic weight loss principles that we've been teaching for the longest time that include specifics about holistic nutrition, exercise, fasting, and the holistic mindset for sustained weight loss. And then 6 other modules which I won't mention. All 10 of these modules are covered in a video format along with Amy Lane's holistic weight loss notes. So that's one part of the program. The second part of the program is the holistic approach to weight loss do-it-yourself guide. So we cover one of these topics every week and post them to the members portal, and then you kind of walk through a do-it-yourself path to find where your block is, why you plateaued, and then you apply those principles to your core modules to find that balanced approach to weight loss so that you can have sustained results. That's the Damie Lean program in a nutshell. If you have questions about today's show or questions about the Damie Lean in general, contact us. If it's about today's show, leave them in the comments below. If you want to check out more info about the Damie Lean, please go to damiehealth.com/join, and you can read all about the different principles that we cover in the program. Again, if you have questions about today's show or you have a topic that you'd like to be covered on the holistic approach to weight loss, the holistic weight loss principles show that we'll be doing here on the Damie Health Facebook page, please ask them in the comments below. If you'd like to tune into the next show, we'll be posting them here on Facebook on Mondays and then on YouTube the next day, and hopefully on our blog, the damiehealth.com, the next day as well. If you've struggled with your thyroid in the past, consider the recommendations that we've done today, but of course consult your health practitioner or myself or someone who knows what they're doing when it comes to holistic weight loss before trying anything new. If you're interested in checking out Damie Health, go to damiehealth.com, and Damie Lean, go to damiehealth.com/join. And if you have had success with rebalancing your thyroid, please share your story below if you feel comfortable sharing it. It's stories like yours that really inspire others to practice this holistic approach and to find balance in their health overall so that they can live a sustained, lean, healthy lifestyle long term. So if you'd like to share your story, you can do so in the comments below, and we would just be so grateful to hear it. The more stories we have about rebalancing thyroid and bringing the thyroid back to optimal wellness, the better. Really, if we can read as many stories about thyroid health as possible, I think that we could make significant change in this overweight culture that we're living in. So much of it is sluggish thyroid, and the causes of that we'll cover in a different episode, but the treatments are very, very simple and so very effective for weight loss, which of course reduces your risk of chronic disease, and now we know can help to reduce the risk of actually 12 cancers. So we're grateful to be able to practice this approach to reduce the risk of these very difficult conditions that people are dealing with. Thank you so much for watching. That's Holistic Approaches to Weight Loss, and we really appreciate you joining the Damie page, and we look forward to chatting again next week. Thanks for watching. Bye.